is not meant to scare you. This is meant to create awareness. That's the watchword, awareness. We need to know. If we don't know, we can't spread it. So I'm going to invite Dr. A.B. Ogini to give us a brief talk on cancer.
Dr. A.B., somebody I'm very fond of. For your information, Dr. A.B. just got married some few years back. To a doctor too. Please, I want to recognize your husband. So doctor plus doctor equals no breast cancer. You're welcome, doctor. Thank you very much.
Thanks, everyone. I'd like to thank you and thanks to Vanessa for giving me this opportunity tonight. So, this is an information session about breast cancer. I'm going to make it as simple as I can, and I can take a couple of questions at the end. I'd like to talk a little bit about what breast cancer is, how we screen for it, and the services that are available here in Ireland, how it's diagnosed, the prognosis, and the treatment. So, what is breast cancer? It's a disease in which abnormal or malignant cells form the tissues of the breast. These cancer cells can grow to invade the surrounding tissues and can spread to other parts of the body. It affects both males and females, however, it's more common in females. It has been found to be the most common invasive cancer in Irish women. About 1 in 10 women in Ireland will develop breast cancer during their lifetime. Breast cancer is also one of the leading causes of cancer deaths in women. So, what are the risk factors that can increase your chances of getting this disease? First of all, it's a complex disease with many factors contributing to its development. So the fact that you may have 1 or 2 of these risk factors does not necessarily mean that you will develop it. If you're worried about your risk factors, maybe because a family member has it, it would be best to talk to your doctor. So the risk factors include a family history of breast cancer, most especially if it happens in a first-degree relative. I'm talking of your mother, your sister, or your child. The more people among your first-degree relatives that have this, the more the people, the more your chances are. Also, genetic mutations. So basically, there are genes in the body that stop growth, the abnormal growth of breast tissues. And when there's damage to these genes, then it will lead to breast cancer. So genetic mutations is a big one. We all heard Sarah say she had the BRCA1 gene. It's a big one because you can do something about it. It increases your chances of getting breast cancer by 80%, and it can also lead to you getting other cancers. Now, the chances of you getting these cancers are increased phenomenally if you actually have these genes. Some people don't want to know, but if you have several members of your family having cancer, it would be good if you got tested. It's a tough choice, and it's good to consider what the ramifications are. But if you got tested and you had it, you could do something about it. Okay. So basically, BRCA1 and BRCA2 genes are the most common genes, and also in men, the BRCA1 and BRCA2 gene mutations are actually more responsible for men getting it. So in a family, if the gene is present and you have brothers, they should get tested too, because if they have it, then their chances of getting it are also increased. Other risk factors include older age. So the older you are, the higher chances are of developing it. Having your first menstrual period at an early age, having your first child at an older age, or never giving birth to any kids, a personal history of breast cancer, or a history of benign or non-cancerous breast disease, past radiation therapy to the breast or to the chest, breast tissue that is dense on a mammogram, taking hormones such as estrogen and progesterone, and excessive use of alcohol. Moving on to breast cancer screening. Death rates from breast cancer have been on the decline for a while now, and these decreases are believed to be the result of earlier detection through screening and increased awareness, as well as improved treatment. Screening refers to tests and exams used to find a disease like cancer in people who do not have any symptoms. So the goal of screening will be to find cancers before they start to have symptoms. Breast cancers that are found because they can be felt tend to be larger. They are also more likely to have already spread beyond the breast. So in contrast, breast cancers found during screening exams are usually much smaller and are usually confined to the breast. Catching it at this stage is a very good prognostic factor. That is, it increases the likelihood that you will be treated successfully if it's caught early. So that's why everyone keeps going on and on about catching the disease early, because it goes a long way. Most doctors feel that early detection for breast cancer saves thousands of lives each year, and that many more lives could be saved if even more people took advantage of healthcare, if even more women and their healthcare providers took advantage of these tests. Recommendations, things that you can do to check, to prevent breast cancer or to catch it early. Things that you can do include mammograms, clinical breast examinations, and self-breast examinations. What is a mammogram? It's simply an X-ray of the breast. In Ireland, there's a government-funded program called Breast Check that provides breast screening and offers free mammograms to women aged 50 to 64. That's because it's highest in this age group. Lastly, the self-breast exam, the one you can do yourself. This should be carried out by everyone, all women. Common advice is, the easiest way to remember it, do it maybe your first day, the first day of your period. Just make sure you examine your breast, first day of your period every month. Women should know how their breasts look, how they feel, and they should report any new changes to your GP as soon as they are found. I'm going to give a list of changes that you can look out for. If you're in doubt about these changes, please see your GP as well. So you're looking out for things like a lump or a thickening, which is different to the rest of the breast tissue. Continuous pain in one part of the breast or armpit. One breast becoming larger or lower. A nipple becoming inverted or changing position or shape. Skin changes which include puckering or dimpling. You're looking for swelling under the armpits or under the collarbone. You're looking for a rash on or around the nipple. You're looking for discharge from one or both nipples. I'm going to talk a little bit about breast examination because some people don't do it because they don't know how to. So it's really simple. You lie down on the bed, do it while lying down because it helps to distribute your breast tissue evenly. Put one hand under your head, and then using your 3 middle fingers, if you just imagine an imaginary line dividing your breast into 4 quadrants. You have the inner outer, the inner lower quadrant, the outer lower quadrant, and the outer upper quadrant. That will just help you remember where you found an abnormality, if you find one. And then you use your 3 middle fingers and using circular rolling motions, just like that. Just feel. You just feel, that's it. So basically you feel, and you also don't forget the area close to your armpits as well. So you feel that way, circular rolling motions. You can use a variety of how hard you want to go deep, basically. And you do that going up and down through all the quadrants, slowly. You do this once a month. It should be simple, easy enough to know what your normal breast tissue feels like, okay? And also look in the mirror. putting your hands on your waist, putting it down and putting it behind your head. Also just have a look at it, and you should be able to notice if there are any changes. Okay, you're looking for any change at all that you haven't seen before. If you notice anything, please see your GP. So not all lumps are cancer. Okay, there will be a lot of things, several things that will be done before the diagnosis is made. These include a medical history. So basically, you'll be asked a long list of questions to see if you are at high risk or not. Also, a proper clinical breast exam will be done by a doctor. Also, a diagnostic mammogram will also be done. So more views than the screening mammogram will be taken. Also, an ultrasound will be done. And lastly, a biopsy will be done. And all these will have to be done before they can tell you that it's cancer. Just so if you feel a lump, you don't go crazy, you know. So all these will be done before it is cancer. However, please go in if there are changes, because even though there are lots, there's a long list of benign, non-cancerous things. It needs to be tested to make sure that it is not cancer. About the prognosis, what are the chances, or what things lead to making a full recovery from breast cancer? These depend on a number of factors, and these factors include the type of breast cancer. There are lots of breast cancers, and some are worse than others. How fast the tumor is growing, the woman's age, and whether or not she has gone through menopause, the size of the tumor, whether or not the tumor has spread to the lymph nodes under the arms, and the presence or absence of some proteins that can help with treatment or can deter treatment. So, moving on to the treatment of breast cancer, there are several treatments that can be used for breast cancer. The decision as to what treatment or what combination of treatments will depend on what kind of cancer you have, and these will be determined by a group of doctors that are taking care of you, basically. So the main types of treatments include surgery, radiation therapy, chemotherapy, or hormonal therapy. And for surgery, it could be a lumpectomy. So if it's cut really early, or if the position of the lump is in an area that makes it amenable, you could have just a lumpectomy. So just the lump and surrounding tissue can be taken out. You could also have a mastectomy, which is taking out the whole breast tissue. And this is usually offered along with reconstructive surgery, unless you don't want that. Basically, reconstructive surgery is using either implants or your muscles from another part of your body to reconstruct your breast tissue. You could also get radiation therapy, and that's basically just the use of specialized X-ray beams to kill the cancer cells. That's usually also given along with lumpectomy or also mastectomy. Chemotherapy refers to the use of drugs that kill cancer cells. Hormonal therapy. Hormones are substances that occur naturally in the body, and they control the growth and activity of normal cells. The female hormone, estrogen, can stimulate the growth of breast cancer cells. So in hormone therapy, what they do is give hormones that will stop the development of the hormones that encourage the growth of the cancer cells, thereby effectively stopping the growth of the cancer cells. Those are the four main ones. There are other treatment therapies. So that's it basically. In summary, things to take away. For earlier detection, avail of the healthcare services. If you're between 50 to 64, please go for a mammogram to find out when they're coming to you. Get your doctor to do a clinical breast exam. Incorporate a self-breast exam into your personal routine. please see your GP if you notice any changes. Thank you. Any questions?